The Kokilaben Dhirubhai Ambani Hospital and Medical Research Institute is an outcome of a dream come true. Inaugurated in early 2009 at Andheri, Mumbai, the hospital is built by the Reliance Group and is the first of the group's flagship community initiatives. This institution is a high-end tertiary care hospital built on the 4 pillars: talent, technology, infrastructure and care pathways. The Kokilaben Hospital comprises of 10 lakh square feet of space and spread over 19 floors, built in conformity with the best of global standards. The 750-bed hospital is supported by 350 full-time specialists, 1,100 nurses, 300 paramedics, and a robust team of technical resources. The hospital has 15 comprehensive centers of excellence for bone and joint, brain and nervous system, all types of cancer treatment, cardiac sciences, Children's Heart Center, the first dedicated center for congenital anomalies in Western India, robotic surgery, transplant with first of its kind, comprehensive liver transplant unit in Western India, emergency medicine, critical care, mother and child, pediatrics, diabetes and obesity surgery, cosmetology and plastic surgery, the aesthetic clinic, physical medicine and rehabilitation, sports medicine. Among all its comprehensive centers of excellence, it has the Center for Sports Medicine. At Kokilaben Dhirubhai Ambani Hospital, we have extended ourselves to a specialized branch of science, focusing on treatment of sports injuries, prevention of injuries, and sports training and athletic performance at the Kokilaben Dhirubhai Ambani Centre for Sports Medicine.
The Kokilaben Hospital Centre for Sports Medicine is unique in that it's a comprehensive and complete sports medicine centre.
Most sports injuries can be treated with proper rehabilitation. And the best part of the Centre for Sports Medicine at the Kokilaben Hospital is that the facilities here are equipped to ensure that our patients return to their best capabilities in the shortest possible time.
The one thing which will make it stand apart is the combination of exceptionally well-trained talent along with some of the latest technology which has been introduced to assist these specialists in the performance of their assessments and treatment plans for patients who have sports injuries and other aspects of sports medicine.
Second to that, you have very cutting-edge equipment if you look at the gait analysis.
The system consists of 4 components: 6 infrared optical cameras capturing human motion in space, 16-channel telemetric EMG representing muscle activity, 2 force plates measuring joint angles and forces, 2 video cameras capturing video in sagittal and coronal plane.
The gait and motion analysis lab helps us identify any abnormalities in your gait. So having something along the lines of a lab that a computer's pace is a lot more accurate, and we can infer a lot more data from that.
Besides the gait and motion analysis lab, the Centre for Sports Medicine also offers superior technological equipment like the balance assessment and training system, which helps in both proprioceptive and balance assessment, as well as training, the Human Performance Evaluation or VO2 Max, multi-joint dynamometer with work simulator, which can measure muscle strength in isokinetic, isotonic and isometric modes, and the Aqua Treadmill, an advanced and unique piece of technology where water provides resistance throughout a given range of motion in all places of movement, providing excellent hydrokinetic exercise. These assessments help in formulating individualized rehabilitation programs.
The nice thing about biomechanics and looking at an individual and how they perform, their fitness and so on, you can spot weaknesses, you can spot trends. So being able to identify all of these problems and then working on them corrects a lot of those weaknesses, and so the athlete's natural talent and ability is then allowed to come to the fore again.
There are two kinds of biomechanical assessments that we conduct at the center. Regional assessment, where a patient has a particular problem like a twisted ankle. And full biomechanical assessment, which starts at the feet and ends at the base of the skull. This assessment helps in identifying biomechanical patterns of weakness present in the body.
We also make sure that our manual therapy skills, our clinical reasoning, and our hands-on approach is also as technologically advanced.
Heath Matthews is an elite athlete trainer who has been the personal physiotherapist to some of the finest Olympic and international athletes, as well as some popular faces in India.
The nice thing about working with high-end athletes and doing that for the last 6 years is that you learn that margin for error is so small, that everybody at that level is exceptionally talented.
Electrotherapy is another effective pain relief tool used after a sports injury. It is conducted by the way of shortwave and microwave diathermy, laser and therapeutic ultrasound, paraffin bath, and transcutaneous electric nerve stimulation.
80% of sports injuries, whether treated with rehabilitation or with surgery, will result in a good outcome. And that means that the sportsman will return to his previous level of sports.
Whether you're a professional athlete or a weekend warrior, at the Sports Medicine Centre, we are able to tell you exactly how fit you are and how you compare to the elite level athletes in your sport or the average person in your age category.
Individuals with different ages, abilities or sports wants to enhance their sporting performance. They want to reduce the amount of time they need to run a marathon. They want to improve their batting swing. So every sport person has a goal in its mind by which he can benchmark and go to the next level.
So essentially a human performance evaluation system boils down to understanding what level you're performing at, what level the benchmark is at, the difference between the two and how we get you there.
Along with state-of-the-art sports rehab and performance enhancement services, should an injury require surgical intervention,
The approach for surgery is usually arthroscopic. In arthroscopy, we use minimally invasive means to approach the joint and then to take care of the problem inside. Arthroscopy today can be performed not only for the knee and the shoulder, but also for the hip, ankle and the elbow joint. So as soon as you find that there's a ligament that's torn or a shock absorber that's injured or the articular cartilage is damaged, we can use these minimally invasive means to treat these and reconstruct these injuries.
the expertise and experience of arthroscopy and sports orthopedics department at Kokilaben Dhirubhai Ambani Hospital is unparalleled.
Kokilaben Hospital has India's first computer-navigated system for knee ligament reconstruction. It's also got Asia's first computer-navigated system for osteotomies. We were the first center to start off with autologous chondrocyte transplantation and with the first center to start off with the use of stem cells in injuries with relation to muscle tears and cartilage tears.
A patient's treatment is not complete without proper rehabilitation post-surgery. Our team of experienced professionals ensure that our patients get back on their feet and walk out with a smile as soon as they can.
Immediately after the operation, the rehabilitation center sent their specialists right to my bed, hospital bed in the ward. And they took me on even from the second day itself, the rehabilitation started. And after that, regularly they kept tab with me with the personalized attention. And within 2 months, I was fully functional, thanks to them.
With the Kokilaben Hospital getting the latest technology and getting the best possible expertise in both the rehab and in the surgical fields, I don't think any of our sportsmen need to go abroad anymore.
We've recently worked with people from the US, from the UK, from the Middle East who prefer to come here. So I think that's a testament to the fact that what we offer is just as good as what you'll find anywhere else.
At the Kokilaben Dhirubhai Ambani Hospital, We have always strived to bring home facilities and technology nothing less than international standards. At the Sports Medicine Centre too, our goal is that our patients receive optimum attention to help them perform to the best of their ability. Kokilaben Hospital aims and lives up to its credo of being a global healthcare institution that combines the best in medical treatment with strong ethical principles and a culture of care and compassion. At Kokilaben Dhirubhai Ambani Hospital, indeed, every life matters.